So I'd like to welcome Dr. Dina Al-Ismail, who's Executive Director of Health Diplomacy at the Saudi Commission for Health Specialties, one of our partners for today's event. So Dina, thank you so much for joining us. And so, we just had a conversation about the immense pressures that are on the global health workforce, be it from budget cuts, just burnout, lack of support, lack of pathways, and even compensation. And you all are doing a lot of work to address many of these challenges. And what we also heard from the panel before, 70% of healthcare workers are women. So you have to look at these within the context of gender. And I want to just start with the burnout question. And there's so much that's being asked of healthcare workers right now. How do you think about better supporting the mental health of the health workforce? It's a little bit, I guess, putting on the oxygen mask before your partner.
Thank you, Kate. Burnout is a huge issue, and we can see it through the past few years getting worse and worse. I think building the resilience of our healthcare workforce is very important. It's a challenge everywhere. For us in Saudi, we're focused, in the Saudi Commission, we're focused on our healthcare providers, and we don't forget also our trainees within postgraduate programs. They also have immense pressure and within the healthcare system. They're big players, and they go through the challenges of other healthcare workers. Some of the changes that we made is implement different policies that enforce the well-being, making sure like working hours, leaves, sick leaves, all of this is embedded in policies that are empowered for our workforce, for our healthcare providers, and our trainees as well. One of the initiatives that we worked at the Saudi Commission is creating an AI and an electronic digital tool that helps with the well-being. It's called the DAM program. It's a tool that provides 24/7 service for our healthcare providers. They can go through it confidentially. They can chat with a professional. It's their choice, either a life coach, a professional coach, or a psychologist that they can chat with, they can meet with via online, where they can discuss their challenges. Also, there has been systems in place for reporting. Reporting cases of harassment, reporting cases of any kind of bullying the providers can face. A third service that the Saudi Commission is providing is legal support. So if any of the healthcare providers within the healthcare system have any legal issues within their organization and they want to consult someone, we have that service provided to our healthcare providers free of charge, where they can consult with a legal service and we can support them as well.
So I want to talk a little bit about healthcare worker safety. And we had a discussion yesterday on this issue where safety came up again within the context of the majority of healthcare workers are women. There are those extra considerations. So what do you see are some policy shifts that we could make to better support the safety of what are mostly women healthcare workers?
Well, I think this needs to come from the top leadership. They need to have strict, very clear policies against any harm towards healthcare providers. For us in Saudi Arabia, we have it at a governmental level. And it cascaded to all professionals in all ministries of health and all private sector. In healthcare, we do have very strict policies against any harm, either emotional harm or physical harm against our healthcare providers. And these are very, a lot of awareness are done for healthcare providers to know their rights, and for those who are within the vicinity of a healthcare unit to it's posted everywhere, so no harm is not tolerated within this organization. You will be reported, you will be investigated if any harm happens. And we're teaching our healthcare providers on their first day in orientation, this is how you handle it. If you ever feel unsafe, if you're in any situation, these are the numbers to contact, this is the email to communicate with. And I think we need to talk about it within our organization. People need to feel that this is a conversation that they can engage with. They don't want, we want them to feel safe enough to speak out. I think one of the problems that we've seen, people are just afraid. And this,
that psychological safety
yes,
as well.
they need that psychological safety within the organization and systems in place for them to report it confidential, and they feel safe that they will not get harmed later on.
So I want to talk a bit about credentialing, and even in our previous conversation discussed about some of the challenges are, well, just lack of appropriate training and some of the skills gaps, but also lack of pathways for growth to attract more people to choose a career and be able to grow in a career in healthcare. So can you talk a little bit about how you see the role of credentialing helping to bridge this gap and also to be able to elevate more women as they choose this career?
So I'll focus of what we've been doing, our experience, and share it with everyone. Probably a lot of people heard that there's a lot of shifts in Saudi Arabia, and women empowerment is a major pillar within the strategy. And that's why you'll see me and see many other Saudi females within these conferences, because we've been empowered and a lot of opportunities has been given to us. So we're always been there. I've been in healthcare for 22 years, but now I have that better opportunities because support came from up. So I think providing that support and encouragement and empowerment helps. Having policies in place also helps. If we talk about credentialing, at the Saudi Commission, we go through the lifespan of the healthcare provider. So now we're working on piloting projects where we mentor people if they want to choose healthcare. Male, females, everyone who wants to enter healthcare, we were trying to create an AI-driven tool where people can go in and put their desires, put their what they like to do, and it helps them, guide them to what kind of career path they go through. And then throughout their career, we have structured different career paths for every profession with clear competency frameworks where they can grow and get credentialed. For women in particular, for focusing on women, we've been working on equalizing the opportunities for women in all of our healthcare professions and giving them opportunities in the training programs. So we're trying to put specific quota and acceptance in all specialties, especially in those specialties that are a bit low in female presence. Also, we're giving a lot of opportunities for work. Of course, we're trying not to be biased against men. I'm very supportive of women in the healthcare sector. However, we want the best fit in every position. However, we've been trying a lot to help and empower women. For the past 5 years, we've in the Saudi Commission, we've trained around 7,000 healthcare providers in leadership, and around 40% were females. And we're trying to push them through the pipeline with all of this support.
Well, just on our final moment here, when you think about being able to do this in a more resource-rich environment like Saudi Arabia, what would be your guidance and advice for places maybe don't have the same amount of resources, but how they can still support their global or their local health workforce?
I think helping them through bringing up the dialogue. This is something that we need to do, we need to change, and supporting one another. I think a lot of, when we talk, let's say, about empowering women in leadership roles, we need to speak about it out loud. A lot of the challenges women face is the unconscious bias against women. A lot of people have these biases, but we call them unconscious because we're not conscious about them. We're just automatically assuming she would not be a good leader because she's a woman, because of all of the history that we have and stereotypes we have in our mind. But speaking about it, it becomes something that is unconscious we'll become more aware of it, we become more conscious about it. So I think starting the dialogue within your teams, within your organization is very important. Every culture has their unique context that they need to look into. My experience is completely different on someone from the US, for example, or someone from Portuguese, or someone from Kenya. So everybody has their own unique context, and we should embrace that context and learn from one another and learn from each other's experiences. We cannot replicate, but however, we can embrace and foster our own uniqueness.
Well, Dina, thank you so much. And thank you so much to the Saudi Commission for Health Specialties for partnering with us on this event today.
It's our pleasure. Thank you very much.
Thank you. So the start of our event, we talked about the pandemic agreement that was reached earlier this week. And so we're going to continue the conversation at really looking at what comes next. And I'll invite Rumbi Chakamba back to the stage.
Thank you so much, Kate. And we have an exciting group of speakers for this particular panel. Please help me in welcoming on stage Nina Schwab, who's the founder and CEO of Spark Street Consulting, Precious Matoto, who is still the co-chair of the Intergovernmental Negotiating Body for a Pandemic Treaty, James Love, who's the Executive Director of Knowledge Ecology International.